Hello, today is June 4th, 2020. It is now 10:23 a.m. and I'm just giving you a report on what's going on in Pennsylvania in terms of the coronavirus right now. So these are the official data from our www.health.pa.gov, and it focuses on the coronavirus only. As you can see, there's that famous virus with the spikes or whatever they are on it. So what's presented here are data by different county, and what we're getting are death rates per 100,000 residents. So what you do is you take the number of deaths, you divide it by the county population, and then you multiply that ratio by 100,000 to get how many deaths per 100,000. So you can imagine if there's 100,000 people in Adams County, you'd find 7.8 or 8 people dead due to the coronavirus. So that's how you read this. And we provide these numbers because it gives you an understanding of the magnitude of the crisis. So if there was like 1,000 per 100,000, that would be really, really scary. Or if there was 10,000 per 100,000, that would be super scary. So we just have to understand the nature of this crisis, and that's the best way to give us a public health perspective. So different counties have different death rates, or we can also call this mortality rate, if you will. The highest is probably Philadelphia, although not really sure. I'll go down to Philadelphia. It's 85.8 per 100,000, and this is interesting because we are seeing health disparities, but it's not easy enough to look just at these data to understand things. What we'd have to do is break it down further. Montgomery County, it's 84.7, so those are the highest ones. I don't know, maybe Bucks as well. Lackawanna, it's 85.4. Delaware, it's 102 per 100,000. So I hope this gives you a bit of perspective. Let's look at the deaths. This is going through June 2nd. So today's the 4th, as I said. So this shows you basically it's I'd call it more of a bar chart than, it's not a histogram really, it's a bar chart showing you the number of deaths per day in Pennsylvania. So the height represents the number of deaths, and the x-axis is the day. Of course, I can't write out all the days. This would be messy. So this is going all out to June 2nd. So we have had the least number of deaths since, back in early March, or mid-March, I should say. So this is complete progress. This is exactly what you want to see. I can't imagine not wanting to see this. I cannot imagine misinterpreting this as where things are getting worse, because you look at these data, this is what they give you. So let's go to this weekly report. The weekly report is published once per week, and the last time was the 22nd, and the 29th followed that. So I believe I covered the 22nd, so let me just cover I don't think I did it in a video. I posted it somewhere. The 29th, so this is extremely interesting, and the way the deaths are recorded. So Pennsylvania is very transparent. Some people would say, well, how do we know that the deaths due to the coronavirus are accurate? We saw what happened in Florida. I heard somebody say that. Well, Florida is a unique case, and I can see they either fired or moved the person who was in charge of the vital statistics in Florida. That's good, but that's them. That's not Pennsylvania. Every state is different. And Pennsylvania is extremely thorough. So if you click this link here, you'll find our death certificate. I'm not going to go into detail here. I'm saving this for my epidemiology course at LaSalle University, but you get a complete detail of how everything is done. And it's really interesting because when causes of death are reported, you have to report them based on the immediate cause of death and then go down to the consequences. So like here, the immediate cause of death was acute respiratory distress syndrome, but if you trace it back to its origins, it comes from COVID-19. So this would be obviously somebody who died from COVID-19. So again, I love how transparent Pennsylvania is. I'm not seeing this with a lot of other states, or maybe I'm just not looking hard enough. In terms of our deaths, you'd expect there not to be much of a difference, although it seems like there's few more females dying than males. In terms of the breakdown by race, I still find this disturbing that African Americans make up 20% of all deaths when they make up only 12% of the population in Pennsylvania. So this is where proportions make a difference, and people use proportions in arguments all the time when it comes to whatever they're looking at. I'm just looking at the numbers. And the numbers show that there's a disparity here in terms of death, and this needs to be investigated. And again, as somebody who does statistics and data analysis, all I can do is point you in the direction. You have to do the research. According to this, Hispanics don't seem to be very hard hit here. In terms of age, deaths, you really are not seeing, it says these numbers are suppressed if they're less than 5, counts less than 5 are suppressed, so that's why you see these asterisks here. You have basically starting to have more deaths occurring at 25 to 29, but very few, only 6 deaths there. Majority of deaths are in the old, like you have 9, between, look how many deaths you have from 80 to, starting say 70 on, even starting 65 on, you have the majority of all deaths. So this disease is affecting the oldest individuals, and again, that's one reason we have to be very protective of the elderly. But elderly people are going out all the time, so it's an interesting issue. I'm sure by now everybody knows that it's deadly to the elderly in particular, but I think the way some people are thinking is like, look, I'm not going to stay cooped up for the rest of my life in here. I'd rather go out and live. And I'm seeing people out, and it's an interesting phenomenon. Where people are dying, you have a lot of people dying, of course, in the hospital. I ignore that because if you're in a hospital, you might be in a hospital because of COVID-19. So I'm ignoring that one. I'm looking at long-term living. There's a lot of people dying in long-term living facilities. So those are areas that are dangerous. I'm not going to get into the specific ones here, but I'll look at the categories. People with dementia, because they're older. That's why you have a lot of people with dementia. Hypertension, see, that's an issue that we have to worry about. High blood pressure. Diabetes, especially type 2 diabetes. Chronic obstructive pulmonary disease, CAD. So a lot of conditions are highly prevalent in individuals who are dying. I know people, including myself, who have asthma, although my asthma was more when I was a child and it's kind of disappeared when I got older, but people with asthma also, but not very many of the deaths. Let's actually get out of the death records and just look at the COVID-19 data itself. What's going on right now? So I like that Pennsylvania reports within the total cases, those are who are also presumptive cases, or probable cases, and they're probable because they have high risk exposure or other reasons. See here, it says probable case by serology test and either symptoms or high risk exposures. That's really cool that we're taking that into account. Because at first I was saying, well, yeah, but this doesn't include the probable causes. Well, now it does. See, I was wrong in that case. And that's awesome that I was wrong. I'm happy I was wrong there. In terms of people who are getting infected, interestingly, we have younger people are less likely to be infected. Now, I'm not really sure if that's because we've had lockdowns where people haven't been in school, they haven't been in college, they haven't been interacting or partying or whatever. So that's hard to say. And maybe these people are out working. Hard to say again. So that remains to be seen. We've had a lot of protests here in Philadelphia and around the nation. Let's see what happens to these statistics when we give this. It's 2-week period that we need in the natural history. We call it the natural history of the disease. Hospitalization rates, though, are quite low in younger individuals. As a college professor, I'm acutely aware of this group in particular, the 19 to 24-year-olds, because that's what our students are. So that's something I'm worried about a lot. And then cases. So this depends a lot on testing, but if we were to assume, we can't assume anything, but if we were to assume that people are tested, have an equal likelihood of being tested in every county, then these data are good. If not, then why are people being tested more in some counties than others? I'd be very concerned about that. And well, that's it. So I just wanted to give you this report here to see what's going on. What this is telling me again is that we should be happy with the progress we're making. We should mourn and grieve for the people who we've lost, and anybody who's been ill and has suffered other consequences other than death, some sort of disability due to this condition, due to this disease. Those people also need to be we have to send our love to them as well. But I'm thinking from what I'm seeing that our future is looking better, and let's keep on progressing. Go out and wear your masks, practice social distancing, just protect the people who are most vulnerable. Thank you very much for sharing this time with me. All right, bye.